Let's take you live now to Anthony Albanese. He's talking Medicare and bulk billing. He's speaking live. He's started to take some questions from the media. Let's listen in.
For people who need those regular drugs to make a difference for a health condition that they have, from 30 days to 60 days means half the cost, but it also means half the visits potentially to the doctor to get a script. Again, taking pressure off the system. We understand that Medicare is at the centre of our health system. That primary health care that GPs deliver makes an enormous difference to people, and the easier they can see a doctor, what we ensure is that health conditions get treated at the earliest possible opportunity. That's good for the patient and people suffering from a condition. It also happens to be good for the taxpayer as well, because what you have is a slight condition dealt with early, treated properly, ensures that it doesn't become an acute condition. So this is a very proud day today. We have across the country, this will be celebrated, and I want to thank all those doctors and people in the health system who do such an extraordinary job looking after their fellow Australians. Happy to take some questions. Then at the end, I have a statement that I'll make about something as well.
Minister, on this change coming into effect today for providers, when is it expected to start saving patients money at a large scale?
Right now. From November 1, it makes a difference. Now, today we're making it easier and cheaper for more than 11 million Australians to see a doctor. This is the biggest investment in Medicare bulk billing in 40 years. And later this week, I will, on Friday, I'll be attending the memorial service, the funeral of the late Bill Hayden. Bill Hayden deserves credit for so much of what he did in public life, but nothing more so than what he did as a minister in the Whitlam government of introducing Medibank. I noticed that some in the coalition seem to not understand their history, because they've gone out and said how fantastic it is, the bipartisan support for that. Of course, the Fraser government abolished it when they came in, and it took the election of the Hawke government, where Bill Hayden, of course, was the foreign minister, to reinstitute Medicare, and John Howard went to elections promising to trash it and to get rid of it. This was not a bipartisan thing. This was a Labor initiative. Bill Hayden deserves absolute credit for the work that he did, and the Hawke government deserves credit for entrenching this as part of the system. But we know, of course, that the Leader of the Opposition, Peter Dutton, when he was Health Minister during that disastrous period where he was regarded as the worst ever Health Minister, tried to get rid of bulk billing effectively with his co-payment, which would have abolished the idea right here that people who are patients here at this wonderful facility can see a doctor for free.
How many GPs does your government expect will actually increase bulk billing under these new settings?
We think that it will have a very positive impact. In two ways. One is it will encourage facilities like this to continue to bulk bill, but secondly as well, it will provide an incentive for more bulk billing from doctors right around the country, and that's what we want to see.
Prime Minister, what does the decision by the High Court over Abdul Ben Breaker mean now for the Minister's powers in being able to revoke a person's citizenship?
Look, we'll examine the ruling and respond appropriately. Quite clearly there was an issue with the former government's legislation, which is what this ruling relates to, but when it comes to the legal consequences, we'll seek advice for the ruling and respond appropriately.